The question always comes up about tube feedings. This is a very common question, and particularly with patients who have advanced dementia. Because with advanced dementia, one of the things that happens is people stop eating. They stop eating for a couple of reasons. One is because they have trouble with their swallowing mechanism. It's very interesting that one of my patients right now is somebody who probably has aspirated a few times. She has very severe dementia. And when people try to feed her, she's swatting them away. She swats them away. And her family asked me about a G-tube. And it turns out the evidence for any benefits of G-tube isn't very good. In fact, the studies that have been conducted have not really shown that they've prolonged life, or they've relieved suffering, or they've improved quality of life. One of the issues is that they haven't been studied as formally as, say, a treatment for an infection or for a treatment for heart disease. The typical gold standard would be a randomized clinical trial. You can just think about the ethical and logistic difficulties of saying somebody who's approaching death and saying, do you want a G-tube or do you not want a G-tube? Those studies haven't been done, and they won't be done. They won't be done. So we're really based with the evidence that we have, and the preponderance of that evidence seems to indicate that there really isn't much benefit from G-tubes. So in our practice with people who have advanced dementia, we don't offer them. Now that's different, and different practices. There are many patients that we care for who they come to our practice, they've already got the G-tubes in. Somebody's already just done that. The issue about feeding, I think, really needs to be framed in the context of symptoms. People are always concerned about not eating or drinking, saying, gosh, won't they be thirsty? Won't they be hungry? Won't they suffer? When people do stop eating or stop drinking fluids, in fact, they don't suffer. They don't suffer. An analogy I like to give to patients and their families is that it's the body shutting down. It's a way the body shuts down and protects us from feeling discomfort or hunger or other kinds of symptoms like that. The most common soft landing is actually that people stop eating, stop drinking, and they gradually slip into a coma. And I frequently will tell patients and their families that this is what to expect. By that point, many people are ready for it to happen now, and it typically doesn't happen now. It typically takes days to sometimes a couple of weeks, depending upon how well nourished and how well hydrated people are and how much they're taking in. But sometimes people and families come to closure and they're expecting things to happen right away, and it just doesn't.